Morgan Stanley. They offered me a boot camp and I wanted to work hard. And I think within 2 years of working there, I bought my first BMW. I was 21.
Dr. Sonya Reddy trained at the world-renowned New York University College of Dentistry. He is a leading functional dentist. Forbes has recognized Dr. Reddy as the most outstanding women in business. Her mission is to build self-confidence through their smile.
What exactly is preventive dentist? Jaws are getting smaller and smaller over time because of the soft diet. So it's not developing jaws. Imagine if they are not breathing through their nose, they're not developing their facial muscles at all. And that causes ADHD, lack of sleep, in kids. I'm a case of orthodontist, pulled out 4 teeth. I needed to have wider arches. So I suffered with lack of sleep, under eye circles. And later on, I think 3 years ago, I fixed myself.
Transcend into you becoming a high performance coach. What are the things that you do with the CEOs?
Make connections with CEOs, which is people that are opening offices by themselves. There's a lot of pressure on them. So while I was talking, I felt there was a need again. So it comes with high stakes.
So many people who are into biohacking, into longevity.
I truly believe in the one biohack, the cold therapy. If I have to look back and say one thing to myself, it's don't feel so guilty about yourself, because we constantly work around mom's guilt. I still have it. I say that out loud.
I have it too.
Yeah, we have it. And have you heard of dad's guilt? I don't think so.
Hi, welcome to another lovely episode of Do You Mind by Deepti Akki, if I may say so. Thank you so much for watching our content. It really means a lot to us, and it definitely means that you love the subject matter and the experts that we're bringing on the show. And it would mean a lot to us, and it would add so much value to me and my team if you can subscribe to our channel. And if you haven't done it, please do so right away. Because we do a lot of research and we actually validate all the content that we bring to you. So do you mind joining us in another conversation with a beautiful mom, an entrepreneur, and a preventive dentist, and also a high performance coach that we have on our show today, Dr. Sonya Reddy. Thank you so much for joining us today, and welcome to Do You Mind?
Thank you for having me. It's lovely to meet you.
I know, right? And I think we've been wanting to do this for a while.
Exactly.
Because one, it's a very nascent topic in India. I think we have not yet caught on to preventive dentistry. My favorite word these days is preventive. For some reason, everything that's preventive health, preventive strategies.
It saves energy. It saves money. Instead of a Band-Aid technique, you can prevent all of this stuff, because by looking at what our patterns are, there's so much in preventative dentistry, medicine, integrative, just kind of healing you as a full person versus just your teeth or just your, gut, whatnot. It's you as a whole body.
And I think these days, there's no other option also left for us except to actually take care of ourselves early on. Yes. To see the benefits and enjoy life later on. Otherwise, with this lifestyle and the weather.
And the onus is on us, right? It's not about, the doctors are not looking out for you. Even in America, the healthcare costs are so much, but I don't think the doctors are looking out for you. You really have to take care. I think a lot of people started taking supplements. There's no regulation in the supplements, really. Doctors are not really recommending supplements, but an average American, takes about, 10 to 12 supplements, and they don't even know how they interact with each other, because people are taking this in our own hands, right? Yes. So, there's so much to talk about it. There's so much still. There's, like you said, even in India, it's caught on so much.
Yeah, right.
And I'm surprised just being here, for a little while. I'm like, oh my God, people are so into this stuff. I love it.
So you have to move back now, I guess.
We'll see.
To start your business here.
Still a cliffhanger right now.
So tell me, Dr. Sonya, how did all this happen? Where did it really start? Why did you want to deal with the root cause and holistic health of people? And more than anything, what actually makes you a successful entrepreneur?
I think it started, journey of healthcare. My parents are into it. So without going way, way back, and I'm sure we'll come back to it. But I think just the journey of healthcare, I was always interested in it, into fitness and all that stuff. It's not as much. And I think I wanted to be an entrepreneur because I saw how healthcare works in America. It was, you can't really try new techniques without getting sued. I could have like, hey, Deepti, I have found this, new herb that I could, prescribe and do this. But, you have to go with what the recommended options are. Like for a cancer patient, you can give holistic medicine as a, certified doctor and licensed doctor. So I wanted to have my independence when I opened my practice. It's not that I want to go outside of the medicine borderlines, but kind of like tiptoe around it, kind of make recommendations to patients how. So I think it really helped me having my journey and having that independence to give patients feedback. Like I believe in breathing techniques, management of stress, and you are not given enough time to spend with your patient to even go through that stuff. Like I love people, I love patients, and especially when they come to you with a concern, you want to help them. Not like, oh, I have 10 minutes up. Sorry, I have like 10 more patients to see. If I don't, then, the system is going to be mad at me. So I didn't want to follow the system. I think that's where it all started. It's like, I want to do my own. That's how the journey began. Like, I want to do my thing. I had no idea I was going to exit. I had no idea I was going to make millions of dollars. The journey was with a purpose. And I thought I would be working till like 65, 70, because that's what my dad did. My dad, he was proud that he never took a day off in his life when he was practicing. And we're not the same kind of generation, right? We need breaks. We need vacations.
Yeah, now you can have a lot of vacations as well, which is a good thing.
I'm trying, like trying to not get like overdo this.
Yeah, but I feel it's important for everyone to hear your story because it's a path that you set for yourself, and professionally and personally, both ways you're very successful in spite of crisis, in spite of situations. And how did this happen from India to US? When did this happen and why?
Always wanted to see, I think everyone knows in India, back in the day when I moved back, when I wanted to go to US, the opportunities were less. There's just tons of opportunities in India. You're either a doctor or an engineer, and there's no other way like for you to be called successful. There's no entrepreneurship really, other than if you opened a store or something. So I saw when my cousins came over and I was like, wow, they're doing marine biology. What is that? So I knew there's opportunity. It doesn't take a lot for a 15-year-old to see that there's opportunity. And then, as soon as I was, able to be independent and, fly away from my home, I jumped at the first opportunity and went abroad just to kind of vacation. It was, I started as like, oh, I'm just going to go tour around, like spend a couple of years and come back. It's like a break year. Australians have that. It's like, we have a break year and we're going to go. It's something like that. I worked through the whole time. And then I was 20, I was 18 and I wanted to kind of go and explore the world, travel the world. And I went there and one after the other just stacked up. I had no idea I was going to stay this many years. I thought my parents were like, you're not leaving. Like, it's just 2 years and I'll be back. And then long story short, like now to so many years.
So how did that shape your life? Being there very young, very new country where you've never been. What are the challenges you faced?
It appeared more like an opportunity than a challenge at that time because you're young, you don't have any responsibilities really. And when I went there, I toured around like all the fun places, and New York really stuck with me. And the buildings and the Wall Street, and just like, oh my God, I would love to work here someday. To getting hired as a recruiter for my friend's company. And I was, really young. And from there, it took off where I made contacts in the, Morgan Stanley. They offered me a boot camp. and I wanted to work hard. And I think within 2 years of working there, I bought my first BMW. I was 21.
Wow.
And, I was like, life was good. I think life was great when I just moved there. The challenges were not a whole lot because I had family and I was kind of like wanting to venture out away from family anyway. So immediately I didn't think there was a lot of challenges because I was loving my life.
So in business, especially in the US, when you set foot as an entrepreneur from your corporate to becoming an entrepreneur, or even studying preventive dentistry to fixing someone's holistic life, what are the kind of challenges you saw in that transition?
So what really stuck with me at that point, getting the job was fun, having this beautiful car was fun. What I saw really quickly that a lot of people are getting burned out in the American system, right? We work a lot. We were going out, and I didn't have a family at that time, no kids. And I was still getting burned out like 3-4 years down the lane. I was like, is this it? Like, this is what I'm going to do for next 20, 30 years of my life. And that didn't appeal to me. And not only that, I was talking to a lot of my colleagues. They were getting burned out, like young kids, like 20 something, getting completely burned out. They were in investment banking, putting in 50, 70 hours. And they were just like no life. So then what I noticed was like, wow, there's a huge need for balance, so to speak, which is kind of frowned upon, right? What is balance? Like, you're supposed to overwork yourself, blah, blah, blah. And you can in your 20s. But what I realized is, what if I was a mom? I'm not going to be able to spend all my time here. I want to spend time with my kids. I think that's what made me realize, like, okay, great money, great everything, but I really want to go into healthcare and really, understand what stress is, where it comes from, healthcare. So that's what made me pivot. So when I decided that, I was working full time and I put myself through boards. So evenings, I cut down all my social activities and I started studying at Starbucks. And my parents didn't even know that I was applying for like NYU right there. Because in their mind, she's like, oh, I'm all settled, and now I was about to take this huge loan by myself, which was more than $500K in US dollars. So that was expensive. And I was not going to tell my parents because I was like, I was going to do it by myself. And then I was going to tell them afterwards. So I did that. I studied, I did my boards really well. I just studied for 4 or 5 months, applied to NYU. I only applied for one school because I really wanted to live in New York. I was not done with it. My life.
I still want to live in the fast-paced life, but
exactly,
I want to crack the balance.
Yes. And I saw that people in healthcare seem like they had more autonomy than, as people were just being told what to do. So put myself through NYU, told my parents, they were not happy with it at all because I was starting my career again. But I think I did really well in the interview. They were not used to people that are like working, making, having good salary, pivoting. So I had to listen to my inner voice. I saw a vision of myself, like being my own owner, like my own boss. And I thought that would be better at that time.
Wasn't that the right time, actually? I think in the last 20 years also, the US market, especially with healthcare, has grown phenomenally. Anything related to healthcare and fitness, I think for most of the developing countries like India, it was actually the cracking point was COVID. But I think for the US, it was way before that, it was that time that you...
Absolutely. Yes. Everyone was getting into the health, we didn't have that much research, obviously, like we have now, but everyone was getting into healthcare. We're recognized in US that the MDs and it's not enough. We needed more. So there's more like secondary people coming up, right? Like physiotherapists, chiropractor, nurse practitioners, because there's deficiency in like healthcare. And like I said, it's like 10 minutes with a patient, 8 minutes with a patient. So I think there was a lot of dissatisfaction among patients too. Like, I don't feel like I interacted with my physician. He doesn't know anything about me. And I think that's when I got in, and it was a great journey for sure. Like, if I look back, I know I did the pivot. It's one of the hardest decisions I had to make for myself, but I had to listen to my inner voice, and it was knocking. And at one point I felt a thump. I'm like, I had to do this.
That's really amazing. That's a great journey that you had. I mean, listening to your inner voice is something else altogether. Like, when you actually, that was the switch which happened with me as well. I did my MBA and I was very happy in a corporate job being a market research analyst. And then I started my own market research distribution company. And then something was knocking my door with fitness. It was always there. It was one of those part-time things in my life. Suddenly took it up. I suddenly shut down what I was doing. And then I was like, I am definitely going to take this leap and see where So I think that transition from corporate, I cannot imagine myself being anywhere except the place where I am right now.
Do you think it is because we are not given options when we were like younger, 18, 17, right? We're not given options and there's just like a path we choose because
Exactly.
we're like, I don't want to be left behind without a path, Everyone else seems to have a path and you pick a path and you realize this is not my path that I would have chosen if I was, making this decision out of, because we don't have any internships. We don't have any shadowship. I didn't know what it takes. Like I knew a dentist and, I don't know what it takes for a corporate person to grow up the ladder or whatnot. I mean, the amount of exposure the kids have with social media now, or our connections, it wasn't there at that time.
I think kids have a lot of clarity these days, right? Like I see my son and he's very clear. It's like, what are you going to be? Are you either an artist or a cricketer, or a builder? And he knows very well what he's going to do. Or I'm going to like be a mechanic, like do a car. I'm like, okay, cool.
I have pretty much went from finance to medicine, from medicine to like now, I mean, I've, few months exited, but it's also because I had diagnosed with carpal tunnel syndrome.
Oh, okay.
And I didn't even recognize that. I was so like in my mind, I just reduced my workload thinking, oh, it's going to get better. It's going to get better. And it tells you like how we're so fight and flight. Like we just want to go and do because you're just brainwashed and you don't want to stop and think, oh, what if it's something that I cannot? So I had like cut down a little bit and I had hired other doctors. And I sold one practice to another one. I felt like, why am I having this much pain in my arm and whatnot? And then even after that, it wasn't getting better because I think it's a cycle of like, chronic stress from overtime. And then I had to make a change, So now I teach dentists. Now I teach like owners that feel lonely, just like me, how I felt.
What was the turning point in Dr. Sonya's life? What was it that moved you from the career that you were chasing to building your business and now to exiting it at a high point?
I think I wanted to definitely do that, which is like have that independence, take care of people. And I did that and felt a lot of satisfaction, like building my own company. I feel like I went through some really dark times building that business.
Okay.
That was probably the toughest times of my life is having 2 young children at home, and coming to work and I didn't want to leave my kids and being this career-driven woman all your life and you see your kids and you're like a different person.
Yeah, I know.
Like, I don't care about career. Like, I don't want to do anything but to look at this, beautiful faces and play with them all day long. I am like totally get involved with the kids. And so it was really hard for me to leave them and go to work. I think that's when I started feeling, oh, maybe there's more to life than just work, And I wanted to take long spans of like breaks with them, not just weekends. And I couldn't do that because I was a sole owner. Mm-hmm. If I had partners, co-partners, it would be better. But I didn't have that chance. I was by myself, doing all that stuff. I think through that, I recognized there's more to life. And my brother always used to say, life is a marathon. Like you're trying to run it like a sprint, And I realized like I enjoy career stuff and I enjoy vacationing. I enjoy being with my kids. So I needed all this stuff in my life.
It's really hard, right? Especially in the US, to be a single parent and to take care of, how old are your kids now?
Now 15 and 13.
Wow. So all this while,
yes,
they would have been really young when you were
really young,
building your business.
Absolutely. You're building your business. It's like a baby. And then you have 2 young kids at home. And, you don't have a lot of support system because all your support system is in India.
So how did you do it? I'm sure a lot of people would love to know. And I'm sure a lot of people will resonate with this as well. If they're going through the same, that you can still be really successful as a businesswoman and also bring up 2 kids?
I don't think people know how much strength they have when it comes to that point, right? What options do you have? When you have so much debt coming out of school, you have created more debt by building a practice. I bought the real estate, all this stuff. So $3+ million debt. And you don't have time to get depressed. So I wish I had something brilliant to say, which is like, oh my God, I did this or that. Really consistently showing up. No matter how I felt, it didn't matter. I'm going to wake up, I'm going to show up and give my best. Because it's at the end of the day, it's not like a code I'm putting together. I'm working on people. I care about you. When I see you, I see a mom, I see a daughter, I see a wife, all this. So I'm like, how can I shortchange a human being? So you just show up and you give your best. And I think that's a motivation because I'm a people person and I have a lot of love for people. And I'm like, no matter what's going on, like I leave it out of the door, show up and be the doctor I'm supposed to be because you're here to see me as a doctor, right? Yes. You don't care what's happening. Oh, you have 2 kids. Your surgery sucks. It doesn't matter. At the end of the day, right? You didn't sleep. Like nobody cares. You're here because you trust me and you want to be taken care of. So I think that's what motivated me is like people want to do the right thing and then just showing up no matter how I felt.
Consistency.
Yeah, consistency.
Hard work.
A lot of hard work. And go home, finish your charts, talk to your kids and feeling, I think if I have to like look back and say one thing to myself, like younger self, is like, don't feel so guilty about yourself. Cause we constantly work around mom's guilt. I still have it. Like I say that out loud.
I have it too.
Yeah, we have it. And have you heard of dad's guilt? I don't think so. I'm not like, making it like it's, sexual based, but it's really dads don't feel that. Dads feel that they're entitled to go out, have fun with their friends because they already create that balance. And whenever I felt like I had to travel for work, I felt super guilty about it. It's like, oh, I'm leaving my kids and they need me. They're fine. And when they see that you're thriving and you're doing well, it motivates them versus, you're like abandoning yourself. They see that, right? Oh, mom doesn't care about herself. Maybe I shouldn't care about myself when I grow up.
And it really makes them independent. I think it's the other way around. The more you're with them, you spend less quality time, according to me. Like when I'm away for a very long time, I literally I just call my son. I'm like, are you missing me? And it's like, I am missing you, but it's fine. You take care of yourself. I'm good.
Quality time versus quantity, right? You can spend 24 hours with them, but you're like irritated with them, annoyed with them, or you're doing like million other things. There's no one-on-one connection.
Exactly.
So I feel that with my friends too. Like I meet them after like 5 years, 7 years sometimes, but I get this one-on-one connection with them and then we leave, do our stuff and then come back. I'm like, we just pick up right where we left off. Right?
I know. Yeah, that's true.
It's like, I don't care what happened, but catch me up, So quality time, I think it's so important with your kids. Like you said, when you're with them 100%.
Yeah. So how long did it take you to build your empire, exit at a certain price?
It happened in stages. It's not like, immediately. It was over a period of 4 years. So what happens with private equity, when they come to you, they want to buy your practice and it's worth something, right? In India, I don't think you can buy a practice and walk away. So in US, if they can replicate the business, it's recurring, right? The patients keep coming twice a year. So you can actually replicate that revenue. And I built it as my brand, but like I was saying, I felt like pain in my hand. I knew I could not work 6 days a week. And also always wanted to kind of step back so I could spend more time with the kids. So my goal was, let me work 3 days a week and I'll have an associate. So when I had an associate, I was able to double the practice by coaching them, training them. We went for trainings as a team. It's all about the team to grow. And once that happened, private equities come to you. They send you letters, right? Hey, we'll buy your practice, whatever. And I had 2 practices at that time. Don't ask me what got me like to do the second one. That's more like a private, the preventative dentistry. When that took off, I wanted to just do that, like in that practice. So there was 2 practices. I was feeling really good about, how I was treating people. It was totally different from what the traditional dentistry was, which is drill and fill. I was preventing cavities. I was treating sleep apnea. So felt like life-changing almost, there was not a single time patients would come and be like, oh my God, you changed my life. Where now, couples are sleeping in the same room.
Yeah, there's no snoring.
there's no sleep divorce, they call it in US. It's like you're not sleeping in the same room. And so they were sleeping in the same rooms. And then we also recognize kids are having sleep apnea. Kids are they're sleep deprived, and they're shown mainly like ADHD. So I was really working on these kind of issues. I was also working with some equipment companies with sleep to do some test trials on my patients. So it was going good. And then, the pain did not go away on my hand. So I was thinking about what my options were. So a private equity company came to me, and they wanted to take that other really busy practice with the associate. And so they gave me an offer for both the practices, but they withdrew it back in the last minute. And they said, this seems like your brand. I don't see like people are going to come to us if your face wasn't there. And they wanted me to work 3 or 4 years more, because that's how it works. So I didn't want to do that. I didn't want to be stuck on another 4 years. So what I started doing was I said, let's me give the busy practice away, and I could just focus on this baby and develop that. So I did that, and I told them I'll show them how they can run this practice, because that's where everything is going, and patients would love this, and they should bring it for mainstream, because they had 50, 60 offices and implementing sleep apnea in many of those offices. And they didn't want to do it because it was risky. It's like, oh, I don't know if it's, going to get patients or whatnot. So I told them I'll show them. So 3 years later, 2.5 years later, I was able to show them increased revenue. I was able to show them better, ways to practice. And I told them I'll help them out by this practice. I'll help them out build their sleep centers. And that's how I was able to exit and not be stuck to the 9 to 5. And I wanted to work outside, bringing awareness to patients, bringing awareness to dentists that they use a different way of practicing. Because everyone, like we talked about burnout before, like a lot of us are getting burned out because dentistry is a very physical job. Women and men are getting into their 40s and getting really tired and wanting a way out, right? There's like whole alternate career that they are seeking. So they don't have to get away from it, but they can stay within it and create more value for patients.
So tell me, I'm sure the people who are watching this would love to know what exactly is preventive dentistry? How does that start very early on, even probably at the age of 3 or 4, and treat maybe dark circles under eyes, maybe performance for a few kids, snoring, sleep apnea, like we just spoke, and so many different issues that I'm sure people wouldn't even imagine that there is an answer to this in dentistry of all the, things.
It was eye-opening for me as well. What we don't realize, I'm going to go a little bit technical here, which is the roof of the mouth is floor of the nose. So the jaws are getting smaller and smaller over time because of the soft diet. Like you said, 3 years old. Like it starts even before, right? By birth, we're giving soft foods like yogurt melts and, soft and softer foods. So it's not developing jaws. And imagine if they are not breathing through their nose and breathing through the mouth, they're not developing their facial muscles at all. So what happens is it's called it's underdeveloped face, mid-face. And that causes to have airway deficiencies. So less air is taken in. So that shows up as like ADHD, lack of sleep in kids. So I didn't recognize that small jaws equal to less airway, right? Orthodontists, everyone will tell you, oh, when I go to orthodontist, they will pull four of my teeth. They'll put them all together. My concept that I've learned is instead of like taking furniture out of the room, why not make room bigger, which is our mouth and jaws, and put all the teeth. We have 32 teeth because we're supposed to be accommodating them, not make our jaws narrow. So when you make the jaws narrow, what happens is your tongue cannot sit up there. You have markings on the side. So what happens when your tongue doesn't sit up there? You cannot breathe through your nose. And nasal breathing is so important because we can filter the nose. We can filter the air in the nose. And there is nitric oxide that's been created to dilate the So you get more oxygen. So you're creating athletes with airway deficiencies, right? In the growing stages. It's not about teeth being, oh, do I have straight teeth? Do I have a good smile? I'm a case of orthodontist pulled out 4 teeth and I needed to have wider arches. So I suffered with like lack of sleep, under eye circles. And later on, like I think 3 years ago, I fixed myself, got myself like a palate expander, expanded it a little bit. So a lot of people are going through this traditional way of treating, right? Oh, teeth have to be perfect, but they don't care if you're really breathing well. And they're doing that to kids. And, their answer is, oh, we've been doing dentistry this way for thousands of years.
And breathing is the most important vehicle,
Exactly.
to connect even the body and the mind. It just raises your consciousness also to a different level.
Exactly. When you get stressed out, we tell them take a deep breath. But if you're breathing with your mouth, what happens is you get, fight and flight response, right? You're always like, sympathetic reaction. You're like knee-jerk reactions. But you're breathing with the nose, it actually creates relaxation. So that's it in itself is an anti-stress.
And how early is the detection possible?
I can look at a child and I can say he's suffering because I could see under eye circles, and I'm seeing more like thyroid disruptions in young kids, like 70-year-olds, 80-year-olds, all because they don't breathe properly. So preventative dentistry, how early can it go? It needs to start really early. Parents have to recognize mouth breathing is not a thing. We see a kid snoring and we think, oh, so cute. It is not cute. The kid is suffering. It is cute, but it is suffering. So we really have.
So what are the kind of interventions available?
I think a lot of dentists do not look at where your tongue is. Even pediatricians, when the kids are born, they're not looking at tongue tie. Mm-hmm. Tongue tie is nothing but like like a thread of fascia under the tongue, and it doesn't stick on the roof of the mouth. So what happens is they can't breastfeed properly. Mm-hmm. So a lot of mothers are struggling. Oh, my kid doesn't breastfeed. He doesn't breastfeed because he needs to have a tongue tie. Pediatricians doesn't know. There's no awareness. Now there's so many research cases have come about. They're talking about this, but dentists are in the primary front area of this. And I don't think in India it's that much common. Even in US, it's probably about 10% of dentists recognize this. Forget the MDs are just like, they're not recognizing sleep apnea. Sleep apnea causes other symptoms in the body, right? High blood pressure, dementia.
Yes.
It's surrounded with
attention deficit disorder.
Exactly.
Yeah.
And chronic stress syndromes, gut issues.
Yeah. And these children grow up to probably snore more.
Absolutely.
And
they're becoming adults.
When is it too late?
When there is obesity sets in, patients, when I have met patients, they're like 70 pounds heavier. One of the patients told me, and I literally wanted to cry because he's like, I can't even get myself to go to the mailbox. That's how tired I am.
Oh my God.
And we normalize tiredness, right? Oh, I have a kid. What do you expect? I'm tired. We have coffee. I'm tired. That's because of the quality of sleep. So now we're getting this aura ring to kind of look at what the levels. So now I think sleep has become so much important because if you don't sleep properly, you don't have cognitive abilities. You're forgetting. There's brain fog, and then long-term memory. Stabilizing. So there's so much. I think research has been done in the last 7 years that people are recognizing. Please don't use that as a, oh, I sleep for 4 hours and this is great. I can survive. It cannot last for a lifetime. You're causing reproductive issues, metabolic issues. All the inflammation is causing diabetes, hypertension, like you name it, it's all affecting.
So how can someone find out when it's setting in? Is there anything that they can do? I
think number one is, are you feeling tired all the time? So we have a questionnaire, I put it on my website. Basic questions, right? Do you feel like you want to, are you falling asleep when you're driving? Can you stay awake and still engage, or you're just tired? So those are the questions. Ask yourself. They're all subclinical questions, right? You go to a doctor, say, I can't sleep properly. Take a sleep pill, right? The doctor doesn't really look at 80% of the MDs are not diagnosing sleep apnea. So we're so used to taking a pain pill for everything, right? That's a Band-Aid. Oh, you have a headache. Let's take a headache pill. You can't sleep. Let's, take a pain pill. But what is happening? So if you have those subclinical, like we talked about, we're taking onus on our own health. This doesn't feel right. Like listening to your inner voice, right? It doesn't feel right. It's not normal for me to be 30 something and I cannot sleep at night.
Yes.
Like what is causing it? Is it stress? Is it, is it something that I'm not able to breathe properly, or I'm able to sleep 8 hours, but I'm waking up tired?
Yeah. Right.
Like you're falling asleep for 10 hours and you need more sleep. You don't. Like body needs 8 to 9 hours of sleep. So why do you need more?
How is it with children though? Do they also keep waking up in the night, or is it just the snoring?
I think there's grinding in adults and kids, and then they wake up, middle of the night, but they also look exhausted in the morning. You tell them, hey, go to school. They're like, I'm tired. Do homework. They're tired. Or they have ADHD-like symptoms, which is attention deficit, right? They're hyper-focused, but there's like only when they're really, really interested. So, but mainly attention deficit. They're not able to focus in class. And you put them on Ritalin in US, which is like what that does is they makes the kids even more like less sleepy. So you're giving a medication, yes, to make them focus, but they're not sleeping well. So overall, you're deteriorating their health.
Wow. So you're not practicing in India yet?
Yes, I'm doing consultations. So my website is just coming up now. I took a little sabbatical, and now my website, I have this, questionnaire. I want to bring awareness. And it doesn't matter. It's in India, it's in UK. I'm helping with the expat community right now in India. And I'll probably work more, but just, I'll give consultations, talk about what they can do, first holistically, right? Yes. You don't want to give them a medication, especially for children. Really understand what the root cause is. Like, is it a, ortho problem? Is it like a tongue problem? What is it? And then at least address that. I had one of my expat patients, I told her what to do. She was going back to US and they told her, oh yeah, finish your Invisalign. So what it tells you is there's not much awareness, even in US. So it's just about coming, but I think there's huge need, and I want to train more dentists to be able to do. I can only cover, even if I were working full time, I'll cover like 8 to 10 patients a day. But if I were to train many, many dentists to do this the right way, that's where our mission is accomplished.
So how did this transcend into you becoming a high performance coach? What are the things that you do with the CEOs? What is the kind of work, exercises, if I can say, actionable items that you give them to perform better?
So the high performance coaching came about like while I was training dentists. I was talking to a lot of people, and I'm just like chitter chatter, like tell me, and I connect with people. And I saw a lot of them went through what I went through, the loneliness in the entrepreneurship. So solo entrepreneurship was the hardest for me. I had to figure out like, how am I going to like practice this way or handle, like if I had a difficult like employee situation or a patient situation, or even like a complicated diagnosis. I had no one to go back to. I had a network of specialists, of course, but they're busy. It's not the same time. It's not real time. So I wanted to make connections with, CEOs, which is like, open people that are opening offices by themselves. There's a lot of pressure on them. So while I was talking, I felt there was a need again. So while I'm talking, I could tell them like, hey, what can you do? They would ask, majority of them were like, how did you exit? Just like you asked me, right? How did you do this? And I'm a dentist. I've been practicing for 20 years. I was not able to exit. In fact, after COVID, all the practices went down because the labor became really expensive. The supplies became double. Like you see, the inflation go up 13 times, but the reimbursements from insurance was not high at all. So we're still making the same amount, but our expenses went up. So there's no way that people could like, how are you doing that? So I was telling them, add other services that actually fulfill you, then it doesn't feel like work.
So why do CEOs actually need coaching? Do you think executives who are leaders would actually listen to you?
I think that executives need coaching because of the lonely place. It's called, my coaching program is called the Lone CEO. And I think we all struggle because when you look at the CEO, what do you feel? You feel like he should know what he's talking about, or she should have a vision. And there's a lot of pressure. Like when they're dealing with employees, they can't fall apart. They can be emotional. And so it comes with high stakes. And that's how I felt like leading a team. I'm supposed to know it all. And I couldn't come out and, have that, you can go out to lunches and stuff, but you have to have that like
Wow, I
authority
suddenly
figure.
feel like I need this lone CEO coaching in every business everywhere.
It
I'm
resonated
alone.
with you. I feel like it resonated with you.
Yeah,
You're like,
what? I had to like, my God, take it on my shoulders. That's a lot of pressure,
exactly.
and especially during COVID, when you're in a service business, you would have felt the pressure like anything.
Absolutely.
In a country like India.
Am I going to close this? Am I going to pay my employees? It's so much. And so imagine having a camaraderie, first of all. So like you could just get coaching from one person. And also I create a camaraderie, like female CEOs. And we have a retreat. We'll go to, go like health-minded people like you. We can go to Bali and, talk about all that stuff.
Let's start a lone CEO club in Hyderabad.
Exactly.
Yeah.
There's a need, right? There's so much need because everyone's pain is their own unique pain, right? It's not about, oh, can we not make our ends meet? No, you just said, oh, you just had an exit. Like, I still have my pains. You still have your pains. And those pains are real to you. I think just being a CEO, we have a different level of pain.
Yeah.
But it's pain. We all have struggles, but who do we talk to, right? You can't go talk to your parents because they probably don't get you, because they're not in the same place. But another CEO, another entrepreneur, like, I get this. And I have done this in my life. Maybe you can. Yeah. And just that sisterhood, the camaraderie, and the like-mindedness of like, we want to constantly push ourselves, right? I've exited. I'm not thinking I'm retiring this is not it for me. All my friends want me to, like, they're like, oh, this is it. Like, what are you doing? I'm like, no, I'm thinking about my next venture. Like, what am I going to do that's more aligned with my purpose?
So you're a single mom, just out of the subject right now. How is it with relationships in the US and in India? What's the difference?
I think in US, it's more accepted at our age. And I have just come to India, so I don't really know a whole lot. You have to tell me that, and I'll tell you US. It's more accepted. It's, people don't look at you weird if you followed your path of righteousness, right? And whatever that is, like, your husband doesn't have to be an abuser for you to leave him. And it's okay to be divorced. It's not that much of a taboo, and you have a ton of options to go meet people, have friendships, and have that kind of companionship, so to speak. I'm not sure how it is in India. You have to tell me.
No, but why should it be different in any country? I think it's just the way we are.
The divorce rate in US is 50%, an average. I don't think in India you find a lot of single men. That's why it's a little different, right? It's just culturally we're more bound, and you see that in US too. Like, I miss that culture in US. We're very strongly connected. Like, I come here, I stay with my brother, and his kids are like my kids. We all go out together. So I don't have a problem like adjusting with my brother when I come here. But you see a lot of American culture, they'll probably stay in a hotel, kind of meet them for lunch and dinner. It's more superficial. So our culture is more like, drawn in. And so when you're drawn in and when you're not relying on your partner for everything, right? In US, it's all about like you and your partner, you versus the world. And you're taking care of the kids, you're the chef, you're the person that's picking up and dropping off people. So this is all you. But here I see all my cousins, like they have like 10 people and they don't rely on their husbands at all. So you get to go have fun with your partner and let him do his thing, like whatever his passions are, you do your stuff. And I don't feel the pressure between the spouses. So maybe that's what keeps them together. And there's other family members, right, to support you. So if you're upset, you don't have to go to your husband. In US, like that's all we do because you don't have lack of connections.
I was living in New York and Bay Area. You lived in both places.
Yes.
So I think there'll be people who will connect with this. Is it too fast paced? After a point, does it get a little too overwhelming living in New York? And how is it as compared to running a practice in the Bay Area?
I've always said, like, there's different things and different phases of life, right? In New York, it's definitely fast paced, but I was there when in my 20s, right? So it was awesome. You know, you get to dress really well, corporate suits. It's, you know, very sexy. And then when you go in the evenings, you're like dressed up in like, you know, mini skirts and whatnot, like tiny dresses, despite the cold, and heels. And you get to experience 4 seasons. And so I loved it. You know, it anchored with me. It resonated with me. You can have 4 seasons, fall, all that stuff, and the high paced. And then when I moved to California, I didn't quite like it. It's sweater weather the whole time, right? No matter what you wear, you have to take your sweater. Like, you have to have a sweater weather. So you don't wear like fancy jackets or like summer clothes. And then it's just more laid back. People are more laid back. And they're all like kind of more creativity there. So they're more like entrepreneurs, like, you know, building businesses. And New York is more like, oh, stock market and, you know, investment bankers and stuff like that like walked up. So it's different. I mean, for me, I'm a New Yorker at heart. I like it, but would I go back and live in New York? Not, I don't think so.
Wow.
After COVID, it's like it's really bad. I still have a place in New York. It's really, really bad. There's needles everywhere. There's homeless people like living in some apartments. It doesn't feel safe like it used to. You know, you heard the whole COVID situation where they went on Fifth Avenue and robbed the whole stores. So it's not safe anymore. Even in Bay Area, California.
But do you think it's the government, or, I mean, what is it? Like, if you're okay to speak about it, because I have a lot of friends and cousins who moved back from the US, and they find more solace, if I can say so, in India. And they feel like they have more freedom here.
Yeah.
Which was not the same 20, 25 years ago. It was more freedom when you go to a Western country, but now it's more freedom when you're back in your own country and connected to your roots.
Right.
Is it the government? Is it the people advising Mr. Trump?
I think it's a segregation. What we've seen last 4 or 5 years is a segregation. There's just pure like red and blue states, you know, and we didn't have that. We kind of merged in together, and it was more about the policies versus the leaders. And now it's become like, hey, I'm red and you're blue and we can't be friends. And it's literally coming to a point where you won't even date somebody or hang out with somebody that's like, oh, you're a Democrat, I'm a Republican. Like, why is that so much segregation? And I feel like that's what puts America back 50 years. And in India, as a developing country, it's not so. You know, you definitely feel safe over here. You come back and it's not that. Like, I don't know how often I talk to my cousins about leadership here. You know, it's there, but it's not so segregated.
We all live together, right? Yeah. Irrespective of the religion, irrespective of the caste, irrespective of the state, the language. There's so many barriers if you can actually see
food.
Through. Yeah, the food. But then, yeah, I think we're very used to being united.
Yes, I love the word united. Yeah, we're united in our own culture versus, you know, you can have different opinions. I'm still okay with you. You know, we still can hang out and we still do it. But I think that's what's happening in US. And more so, well, let's see what happens in the next 5 more years. But yes, I think there's almost like a exodus of, you know, American Indians moving out. Not only just American Indians, I think in general, US was recognized as this like, you know, land of opportunity, blah, blah, blah before. And people are like begging to differ now. It's like, maybe not so much, you know, and they would rather live in their own countries. If they come from European countries, they want to go back and see America as like, I'll go, you know, once in a while to shop and stuff. So yeah, that's what I'm noticing.
You're also into biohacking. I think clearly it's a lovely subject that I experience when I travel to different places. There's so many recovery tools out there. There's so much science to it at this point. People like Brian Johnson. There's so many people who are into biohacking, into longevity. What exactly do you cover in biohacking?
I always go back to the roots, right? You can talk about, I can biohack like 20 years younger. Does that happen? It doesn't happen. So the realistic side of biohacking is what can we do to keep the whole well-being? And I think the number one thing I talk about is the sleep, right? Get good amount of sleep, have good habits. I think when we're younger, it was like, we stay up till 2:00. This is so much fun, right? Now the biohacking is like, I want to go to bed on time. I want to get my 8 hours of sleep. I mean, start with basics, right? If you're not sleeping well and I cannot biohack my way in my DNA, it's not going to work. So start with basics, like eat healthy, whole foods, sleep well, and then, breathe well, which is breathing exercises, yoga, spend a lot of time grounding yourself, like outside, for people that want to just walk around. So walking is really good. Exercising is really good. Apart from that, we've seen like cold therapies that come up. And I truly believe in the one biohack definitely believe in is the cold therapy, which is a cryotherapy. And there's a lot. I think it talks about like the reason why I like it is it talks about how we have the knee-jerk reactions to things, but just doing the cryotherapy, sitting in that uncomfortable place, it teaches you how to balance when things go off balance, right? We were talking earlier about my lowest point in life was, when I was the lone CEO, young kids at home, which is the most dark place I could be. And the knee-jerk reaction was like, screw this, I'm leaving, bye. And, you always have this option of like, I can just move back to India, but what makes you stay there in that uncomfortable place, and what does it take? It's been practiced by military people the whole time is a cold showers in the morning. So I love the cryotherapy. I think it makes you stand still despite the hard times, because when you do stand still, there is light at the end of the tunnel.
Yeah, that's true. I love that. Light at the end of the tunnel.
And connection the biohack to like mental balance, right?
Yeah. So we're coming to the end of the show, Dr. Sonya, and I would love to know, because Do You Mind resonates and stands with comeback stories, whether professional or personal, and covers stories where, people have something in depth to talk about their careers and technical stuff, but also something which is very spiritual about them, which is very close to their heart in terms of how they've conquered life in itself. So I'd love to know what comes on top of your head.
So I talk about my dark place or
anything.
I feel like the toughest part of life is, when you are this ambitious person and that wants like everything from life, right? You're this positive, like, golden eye girl that wants everything from life and wants to see it all, which is you want to be a mom and a career woman and to be a good wife. And when you want it all, and you think that there's some sort of balance, and there's no balance. Some days you're just like, oh, your kid is sick and you're just, want to be a mom. And some days you're like, oh, I'm learning this new thing and I want to really focus on that. So I feel like I keep going into rabbit holes, and then I will keep thinking to myself, oh, I'm not being the perfect myself in one place. I think that was the hardest thing, is to somehow in my younger years to think that, oh, it's all going to come back together and it's going to be beautiful and, super amazing life. But I think just learning that, I'm sure you experience this. It's like a lot of pitfalls along the way, right? And a lot of unforeseen events that you cannot control.
And it's not always as perfect as we think it is, or it's going to be.
Yes.
You just get used to the imperfections along the way.
And understanding what you can control, and what you cannot control, right? There's others you cannot control. You can always control your mindset, like workouts, and de-stress yourself and kind of take situations in a calm manner and not react as quickly as we want to. I think that's my biggest comeback in life would be, if I have to tell a young generation like what you can expect, get a ton of camaraderie, create this community. It doesn't matter in India, in US, you have to have a community where you're like, those 5 people will do anything for you. You can call them in the middle of the night and you got them. I think when you have the sense of community, it doesn't matter which country you are in. You shouldn't feel like, oh, my parents are in India, like my parents are in US. It doesn't matter. You got to have a great community. And that's what I'm working on, is for, high achieving people. Like they don't have time. I didn't have time to socialize with my friends. Or when I came to India, it was like, oh, I'll go on vacation versus connecting with my other friends. So create the community wherever you are, and rely on each other. And also I think another thing is a delegation. I was really bad in delegation. Ask for help. When you're a mom, you're an entrepreneur, you need so much help and non-judgment space. So this CEO coaching place would be completely non-judgmental. We can talk about, all about the difficulties we had or all about the successes we had and celebrate each other. There's no place for jealousy. And we do retreats together. We do biohacking together. So India is a great place for that, right?
Yes,
There's so many,
it's getting there.
Places here that we can go spend like a weekend with other women and just holistically
And
heal
most
ourselves.
of this has always been a part of yogic science. I mean, anything that we're talking today has always been there. I think the topmost part of biohacking is breathing right.
Yeah.
Which has always been there. The pranayama, the way to breathe.
Yes.
It's been there. It was written in the books.
Breathing, meditation, it was always there. I feel like it was gone away for 50 years and then we're making a comeback.
Yeah.
The castor oil therapy. I mean, It was all there.
Yeah.
Your grandma said, told you to do this and we never listened. Now we're coming back to it.
Exactly. That's the comeback.
That's a comeback. Like all the biohacking our grandmother said, we never listened to.
Yeah. How life is at this point currently in the US and in India, and why people want to come back to their country and feel more free here. So what is the kind of advice on an ending note that you would give to someone who would want to move to the US in this year?
I think if that's your inner voice, right? Pursue that, but don't make a long-term commitment to it, right? I would say the same thing with the reverse, right? People in US don't think you're going to move for life after being in US or other countries for many, many years. Take a sabbatical like me. Take it I don't know, one day at a time. Or if they're moving for education, move there for education. See how it goes and how it works out for you. If it doesn't work out, if it's not resonating with you, do what's good for you, right? Like if my cousin moved back and it worked out for them, it doesn't mean it works out for me. Yeah. Or my family, So I think it was great, like non-pressure way for me to take a sabbatical, spend a lot of time in India since many, many years. And I love it for what it is. Like it's got everything, and it's missing a few aspects of it, but like any other country, like anywhere you go, you don't get 100% of everything. So I think take it one day at a time. If you really want to move back, understand the repercussions of it. But if you want to go, stay for a little bit and move back. Nobody's judging you.
So testing the waters is the way to go. It's the mantra. I hope you enjoyed listening to this conversation. Please do comment below. Let us know what you think. What are your thoughts about an Indian American or an American Indian moving back to India? We would totally love to know what's in your mind and your thoughts. And I'm sure Dr. Sonya will take some time out to respond to your comments as well. Thanks again for listening. Right. Thank you, Dr. Sonya.
Give a heart to everyone.
I'm sure
stay healthy and wealthy.
Thanks again.
Make sure you subscribe. She's amazing.
Oh, thank you so much.